Hi, welcome to Ripples Rising, empowering voices, creating waves of change. Today, I'm joined by fellow Rippler Diane Carbo, a registered nurse, caregiver, advocate, and founder of caregiverrelief.com. She has so much information on her website, caregiverrelief.com. With decades of experience helping families navigate the challenges of caregiving, Diane has dedicated her work for supporting those who often put everyone else first. Through education, coaching, and advocacy, she gives caregivers practical tools, encouragement, and a voice because when caregivers are stronger, the ripple effect reaches entire families and communities. Today, we'll explore the realities of caregiving resilience and how one voice can create meaningful waves of change. Hey, Diane.
Hi, thank you so much for that lovely introduction.
Yes. Hey, your website, you've got so much information on there. And, when I was thrust into the family caregiver stuff 6 years ago, there was nothing for anybody to look at for resources. And even if we didn't know where to start because we're just trying to put out the fire, right? And here you are. So tell us about yourself and what you're doing.
Well, I've been a nurse for 54 years. I've done a lot of different nursing in different arenas, and my concern right now is the senior market. They all want to age at home, and the family caregiver, and I help them navigate the medical delivery system. But today, my passion project is to raise national awareness and start an ongoing, honest conversation about what is really happening to older adults and family caregivers in this country.
Mm.
You are well aware of it with your Roar. I also belong to Roar. I'm not as active as you are right now, but I'm really concerned because we're having an unprecedented number of unsafe discharges to home. And the family caregiver is the invisible healthcare workforce inside America's homes. We have 63 million family caregivers that provide $1.1 trillion
Mm.
in unpaid care.
Yeah.
And it's frightening because the average caregiver is about 51 years old. Most of them are women. Um, but the picture is very clear what I see happening. Caregiving has become a distributed, home centered healthcare system, largely powered by families.
Yeah.
And our healthcare system is still acting as though the care ends when the patient leaves the hospital. And that is not happening at all.
No.
The responsibility is simply transferred to the family caregiver, and that's done without training, without preparation, without equipment support, or realistic planning.
Absolutely. Wow. So spot on. I mean, yes, my career has been in real estate, commercial real estate. I can, do a 25-page contract regarding leasing or selling or anything. But when I was thrown into the caregiving, I had no idea. And of course, I trusted a home care agency that was hired to take care of my dad. It's just like if you're going to hire me or use me as your realtor, that you expect me to know my business and how to best take care of you. So that's what we did in a crisis moment. We don't have time to interview three or five caregiving agencies. We just, oh, I heard one. Okay, let's go with this one. And that was it. So, and the majority of people, want to age at home.
Yes, they do.
And so, I mean, it's more expensive. So tell me, Diane, is it more expensive to have somebody sent away to assisted living? So you got assisted living, then you got independent living, assisted living, nursing home. So those
Well,
costs can be anywhere from what,
let's talk
10,000?
about those arenas. I've worked in all of them.
Yes.
And I can tell you right now, assisted living is the most dangerous of all the medical delivery systems. And
Mm.
I will explain. It's
Uh-huh.
based on a social model, not a
Mhm.
medical model.
Mm.
And therefore, you are, as an individual, are supposed to be able to direct your care.
Mhm.
And what I'm seeing is, well, right now we're at a critical turning point in how we care for our older adults and how we support our family caregivers.
Mhm.
And caregiving is no longer happening primarily inside institutions. If you have a family member in an assisted living, you're paying big bucks for independent living.
Mhm.
People don't understand that. I really have a hard time with memory care units in assisted living.
Mhm.
They have the people in those built in those facilities, because I know I worked in some um, several assisted livings as a DON. There is no behavioral training. There is
Mhm.
no staffing according to the acuity level. And when you have several people at different levels in with dementia in a memory care unit not getting care, it's very frustrating for me to see. But families seem to accept it.
They don't know any different.
I know, I know, I know. And that's what's happening. And right now we have um, a really big healthcare crisis because unsafe discharges are occurring at record rates.
Yeah.
Our Medicare reimbursement has cut the level of amounts of payments for therapies in rehab.
Mhm.
The result is we are seeing people, if you have a Medicare Advantage plan, you have a stroke or something, you may be in the hospital only 11 to 14 days.
Mhm.
We have the illusion of healthcare, and we have the illusion that, yeah, you have 100 days of rehab coverage, but that is no longer the case.
Yeah.
You are getting discharged to home, and skilled care in the home care setting has also been cut. So
Really?
there, the family caregiver is expected to provide care once provided by healthcare professionals. People are afraid to send their loved one to a nursing home, but
Yeah.
at least there at a nursing home, it's regulated. And
Mm.
um, I tell anybody who is in assisted living, you still have the responsibility to make sure that they get medications. If they need therapy, you have to have a home care company come in to provide that therapy.
Mhm.
There's all kinds of things. Home care right now, the skilled home care does not pay for a nurse to come into the home anymore,
Mm.
which is shocking to me because the that everything falls on the family caregiver, the spouse or the adult child,
Yes.
neighbor or friend. And the all of a sudden you're expected to manage medications, mobility issues, seizures, toileting, transfers, understanding equipment, setting up appointments, insurance issues, and the list goes on and on.
And now we're called the club sandwich, not just a sandwich, but club sandwich, because in
Yeah.
addition to the numerous things you just mentioned, at least 10, then you still got to get your kids to the soccer game and
Yes.
ball practice and
Yes.
horn playing
Yeah.
and make your husband dinner or whatever. I mean, there's caregiver burnout, and that's kind of what you talk about. Yeah.
Oh my God. Well, what's frightening to me is we're having, there's a big thing about all the hospice fraud right now.
Hmm.
And people are being signed up for hospice that really aren't dying. And there's unsavory things going on as far as the people that are selling the hospice or to the family. Oh, you've got all these great benefits, but then they provide nothing, and the families don't know. I want to share a story that recently happened in this past year. Of my neighbors, Karen and Frank. That's not the real names, but that's close enough. Because their story represents what so many families are experiencing right now. Karen had a heart attack about 15 years ago. She was an attorney, a family law attorney. And that heart attack was when she was at work that left her with low oxygen for a period of time. So she has short term memory problems. More recently, she started having, she developed urinary tract infections that worsened her confusion. And all of a sudden, seizures were finally recognized and treated. She was probably having what we call subclinical seizures the whole 15 years, but were so brief that it wasn't picked up. So she goes to the hospital because her seizures were bad and they were getting worse. And, she, the seizures were masked probably because of her cognitive issues that she was having. Still a funny woman, cute as a button. She was very tall. She was hospitalized and stabilized and sent to acute rehab, where she was just totally, because she was a big woman and she was in bed for 14 days, she had really decompensated. Um, she was only there 14 days, which really surprised me. I was shocked. I wasn't home the day she came home from the hospital, but I was here the next day. After rehab, they discharged her home with a wheelchair. Now, here's the thing. Frank, the husband, did not have any meaningful discharge planning. He was not included in it in any way, shape, or form, which was so wrong. No one evaluated the home. No one addressed the fact that there were 17 steps leading to her bedroom and accessible bathroom. No one made sure Frank knew how to safely transfer her. No one prepared him for the nighttime confusion or the bathroom transfers. Now, Karen fell within the first hour of being home. This was a discharge planning failure, and this happens a lot. Now, I want you to know, I would have sent her right back I would have called an ambulance and sent her right back to the hospital, but I wasn't here. And Frank said, oh, she wants to be home. Well, there were a lot of things that went unanswered. And I personally called, oh, I was so angry. Here she is sitting. She had no accessible bathroom to get to. She had no bedroom on the first floor, no bed, not even a safe recliner, because they had these bamboo shaped, kidney bean shaped swivel chairs that they sat on. She spent her first night after being discharged to the hospital there. In fact, when she fell, Frank called my roommate's daughter, who's in nursing school, and said, "Hey, could you come over and help get her up?" And a student nurse says, "Well, where's her bedside commode?" They didn't even order her that, and we couldn't get her to they couldn't get her to the bathroom. So I come the next day and I'm like, what in the world? I actually called the hospital. I called the physical therapist. I called the physiatrist. I called the head nurse of the rehab unit. And I called the administrator of the hospital and the director of nursing. I was livid. I said, and they all told me the same thing. She was independent. She was ready to come home. Well, sending them home with a wheelchair is not a discharge plan, and it says nothing that says she's independent. And so I was waiting for her home care company. I said, well, when's the home care company coming? Because there's a lot of issues here. We need a bed. We need this. They had ordered home care. They called the home care agency to warn them about me. Can you
Yeah.
imagine? Yeah, they warn them. God forbid. I'm a rebel rouser. Well, this was
Yeah.
unacceptable. And this physical therapist was familiar with Karen. And I said, "Is she independent?" And he said, "No." And the hospital would not order her a bed so that it would be paid for. they didn't want to deal with anything. And the other thing that was really disturbing is that's when I learned nursing is not paid for in skilled care anymore, or skilled home care. And that leaves the nurse. Karen kept saying to me, I have a urinary tract infection. I said, well, how could they can't send you home with a urinary tract infection. She goes, I just know I have it. And she did. And a nurse didn't come out for days. And the sad part is, a nurse doesn't have to come out, if they come out at all, for 72 hours. So what we have is physical therapists opening up cases because they get reimbursed for their care, their
Mm.
services. But what we're doing is we're not, she had new seizure medications. True story, she started having what they call status epilepticus, which is on a constant ongoing seizures. They're really bad. They actually sent her home with a syringe in a bag that was for him to give her if she was to a point where she wouldn't stop seizing. I'm like, I called up the pharmacy. I said, what is wrong with you people? Well, we gave it to him. I said, does he know how to give an injection? Because this was an IM, intramuscular. It's deep
Ah,
muscle.
oh,
It wasn't
oh.
a sub-Q. And they didn't tell him what it was for. It had a little thing on it. It was so tiny, the reading, you couldn't tell what it was. And they said, oh, well, we thought the nurses taught him. Well, the nurses at the hospital are not educating people or the family caregiver at all. So the family caregiver has become the unpaid workforce that's holding our entire system together. And it is frightening. We're seeing, I don't know how we're going to deal with this. Well, first of all, families are not even aware when they're discharged that they have rights. They can argue this and fight this. And I have another client. I have a woman. I'll call her Cheryl, and Cheryl has a husband that has MS. He had an incident where his back was hurting. They sent him to the ER. The ER sent him back and said, "You're fine." Well, the next day he couldn't even get up and walk. So
Yeah,
they didn't do any testing. Oh, this is our healthcare system.
yeah.
It's all has to do with the Medicare Advantage and managed care. We're just going downhill. We really don't have healthcare. We just have the illusion of healthcare.
The illusion. That's
Yes,
right.
it
That's
really
correct.
is.
We have the
And
illusion of yeah.
yeah, and Medicare has moved to a cost sharing plan.
Mhm.
And this is something people don't understand that with with Charlie, uh, her husband, he had MS. He had had spinal surgery. They sent him home after a week in the hospital. And as soon as she got home, same thing happens. She tries to transfer him. He falls on her,
Oh,
injures her, needs to go and have surgery again on his back. And this is the kicker. This just blew me over. It just made my head explode. You now have patients' rights in the hospital, in
people,
rehab.
yeah, you need to expand on that. You need to,
Yes.
how do people know there are patient rights?
Well, here's the patient rights that the nurses are pushing
Okay,
that really I find offensive, and the politicians. This all has to do with politics.
it does.
Patients have a right to fall. They have a right to deny turning so that they can develop decubiti or pressure sores. They have a right to um, refuse any treatment, and even if it causes harm to them. So Charlie goes back to we have him in the emergency room, and as they're admitting him to the hospital, now he had just been in acute rehab. He was a severe diabetic, and he actually had decubes, undocumented wounds on his heels and his buttocks and his elbows. They were because they let him lay however he wanted to lay without and it caused him harm. Now they're still dealing with the fact that he may lose his um, his feet because but there is no accountability by the facilities to do skin checks. They're not doing their jobs and is causing patient harm.
Wow.
And that is what I am concerned about. I created, I'll tell you what, there is steps you can take in the sense of Cheryl and Charlie. I said to her, you cannot let him come home like he did the last time.
Right.
And they told him, told Charlie, hey, you're going home in a few days, and she's not, Cheryl was not prepared at all to have that. She didn't have anything ready. And it wasn't accessible, and nothing was accessible. So I told her, you have a right to file a complaint with Medicare, and there you have to just ask the facility what is the Medicare number so that they can provide you with a source for appeal. Well, she would fill out the form online for the Medicare discharge appeal, and she would submit it, and the hospital would get a call from the agency saying, we understand you're sending Charlie home today. His wife feels it's unsafe. And their response was, oh, don't worry. We haven't written the discharge yet. So they started playing this game, and for 3 days they did the same thing. He's going home tomorrow. She would appeal it. They didn't even get through the appeals process at all because the hospital was saying they said that they weren't right. He hadn't written his discharge. So they play that game. But while they're playing that game, the facilities are telling the family, hey, you will be financially responsible for this stay if you don't if you don't go home,
Yeah.
and the appeals doesn't go in your favor.
Wow.
Well, first of all, there's no way in God's green earth that it wasn't going to go in their favor, but they couldn't do enough fear mongering in these people. And the sad part is, and this is something with Medicare Advantage people need to be aware of, is Medicare Advantage now. If you have, Jackie, your head will explode when you hear this. Medicare Advantage has a $200 to $400 a day copay by the consumer.
Oh, yeah. Thank you. Yeah. 400 bucks a
So
day.
that's why I say we only have the illusion of healthcare.
Illusion. We're going to wrap up in a bit. And
Okay.
what you were talking about, though, reminds me of a story I heard just this past weekend. One of my friends, her father is 94 years old. He's in a nursing home 2 hours plus away from here. And they called her that they're going to put him on comfort care. Comfort care. I guess that's a new word now. Comfort care in a hospice. Comfort care. So she went over to go see him. He was curled up in a fetal position on the bed with little old skimpy blanket with the air conditioning going. Yes, he was cold. He had only his diaper on and no shirt on. No. And so she came in, she got him some clothes on. She started giving him some milk and some water and started feeding him a little bit. He started sitting up vertically in the chair. Um, I'll tell you a secret. I guess it's a secret. His urine was really cloudy and nasty. And so she went and got some beer and put it in the water. He
Mhm.
says, oh, I like that. And his urine became better, of course, to get him going again and everything. But they were ready to give him morphine and put him down. And she said, you are not going to put him down. She hadn't been there about a week and a half. It's a 2 hour plus drive. She is 67 years old herself. And they were going to put him down. They're tired of messing with him. And she went over there and she got him up to go to the bathroom and got him to start drinking and eating. He was dehydrated, of course. And no, he's not put down. But what you're saying, it's just my mind's exploding, my head's exploding. Everybody who's not in this, you don't get it how dire
Yeah.
our situations are right now. I mean, you might get it next year, but we're telling all these stories so you understand. So there's avenues to listen to and resources before all of a sudden you find yourself in a crisis.
Yes. I've created a safe discharge checklist on my site. So see, and it's free. It's just, come to the site, go into the resource section, you'll find it. I also have created a caregiver story section where I'm asking family caregivers, we need to collect stories. We need to hear them. I think if we collect enough stories over time, we can present these to our politicians, our uncaring, cold-hearted politicians, to
Yes.
wake them up to what's needed. So I'm trying to help caregivers. Whatever your story is, it's your reality, and there's so much harm being done by our illusion of healthcare to our family caregivers and our seniors. We cannot ignore it. There's another thing that's going on I just want to make you aware of. We also are going to have, we don't have a nursing shortage right now. We have a shortage of nurses who will not work in unsafe conditions. And the baby boomer nurses are going to be retiring, and we're going to lose about a third of our nursing workforce in the next few years.
Yeah.
So between the family caregivers and the lack of nurses, and the young nurses don't want to be working for the little pay. They see it as little pay for the abuse. They're getting beaten up by patients, and they're getting beaten up by the management. And the response from every management team, company, or hospital in the country is, oh, let's provide them with a pizza party. That's not enough. These
No.
nurses are the young nurses are braver, or just don't put up with the amount of BS that older nurses used to do and take.
On that people, they go in, they go talk to the CNAs, the CNAs who are doing the grunt work, the nasty work. The CNAs know the patients more than the nurses do.
Yep. And you know what? It didn't used to be that way. In
No.
fact, when I was working in the hospital, or even in a long-term care unit, I was called, the aides would call me a working nurse, because I find it offensive when I'm in a nursing home or whatever. And yeah, I have a lot of responsibility. I have pills to pass for 30 people. I have nurses' notes to write, incident reports to write. But I was always surprised when the aides didn't ask for help. So I would always offer. But nurses nowadays don't want to do the hands-on care.
No.
And we've lost our sense of doing an assessment, of educating. We've lost the opportunity to educate our patients, because it's just rush through.
It is.
So, yeah, even you only get paid, the doctor only gets paid for a 15-minute visit when you go to see them in the hospital, or
Right.
when you go to their office.
Yeah.
And in 15 minutes, they're supposed to assess, listen to you, assess, diagnose, or do treatments, possibly diagnose, uh, provide a solution, and document all in 15
Document.
minutes. It's
Yes.
not possible.
No, it's not possible. And not only the loss of what you were talking about, which is the education and the protocol and the assessments, but
Mhm.
the loss of caring, Diane.
Yes. Yes.
Because one of my nurse friends, you can't teach people to care.
No, you absolutely, that's the third time I've heard that this week. And and you just can't teach people to care. And I think that's one of the hardest parts. I could be retired and be comfortable, but I feel a need
Yes.
to be a voice, to say, hey, you have rights, and you do have rights to fight a discharge. You do have rights to I report doctors to their licensing boards. I report facilities to their credentialing agencies. I go through a whole gamut of things because that's how I roll.
Yeah, I
And
like
I
it.
work in the military medical delivery system, and right now, Jackie, our healthcare system mirrors it. It's delay, deny, and wait to die is what our benefits.
Delay, deny, and wait to die. Boy, there
Yep.
you go.
Yeah. Oh,
Wow. Well, we're going to wrap up Ripples Rising with fellow Rippler Diane Carbo. Go to her website, caregiverrelief.com. And did you say, is it a resources?
yeah, and I have podcasts and resources, but they can find what they're looking for in the resource section.
Excellent. All right. Y'all have a great day. Be aware, take care, and be prepared.